right.
So
Sounds
we're
good.
gonna start whenever you're ready. So whenever just take a couple of deep breaths, then pause for a second and start when you're ready. Okay.
Okay. Call for it too. Okay. Hello and welcome. My name is Dr. Hinton. I am the founder of Hinton's
Okay. Hold on.
Integrative Medicine.
Hold on. So we don't need to do the intro again because I know we say we're doing a
Oh,
rehearsal, but I recorded it because you sounded so good. So we're actually done with that.
oh,
Yeah.
okay, okay,
Yeah.
okay.
Yeah.
You didn't tell me that. See,
I
communication
know.
is important.
I ain't want to tell you that because people normally mess up when you tell them that they start recording, but I recorded it. So
True.
yeah. So I knew you
Okay,
were gonna sound
cool.
good doing it. So you can
Okay,
skip the
cool.
intro. We can just get right into it.
Okay,
All right. So whenever you're ready, just start.
so let's start off with the pancreas and the role of the pancreas. The pancreas is a little gland that's located in the abdomen. And what this little gland do, it makes insulin, which is what is necessary to lower the blood sugar in the body. And so when this pancreas is not working properly, it either does not make insulin, makes too little insulin, or the patient may become insulin resistant. So this little gland plays a very important role in the lowering of the blood sugar in the body. So let's jump into the types of diabetes. And I won't go much into details, but I don't want to assume that all of the audience and those who are watching know what diabetes is, the different types, or what the symptoms and signs are. So let's talk about prediabetes. So prediabetes is a condition in which the person has a higher level than normal blood sugar, but it's not high enough for us to diagnose that person with diabetes. So in their case, we're teaching them about lifestyle changes and doing things a little bit different. And we'll talk a bit more about that later here in the show. All right. And so the next one will be type 1 diabetes. So type 1 diabetes was formerly known as juvenile diabetes or insulin resistant diabetes. And the reason why we kind of look at it at these terms is because we normally saw them in our younger generation, or we also knew that because the pancreas was not making insulin at all in these type of patients, that they needed an outside source of insulin to lower their blood sugar. So that's why we see this as juvenile and insulin dependent. Now we'll go to gestational diabetes. Gestational diabetes is where we see this in our pregnant women. So these women, they come in, their blood sugars are a little bit higher than normal, and maybe they never even had diabetes at all prior to this. So with these patients, we want to make sure that you're keeping your blood sugar under control because what happens is you put yourself at a greater risk of developing type 2 diabetes afterwards if you do not properly control your blood sugar while you have gestational diabetes. So that's very important. Now we'll talk about type 2 diabetes. Type 2 diabetes is the most common one. It's the one that most people know and talk about when they hear diabetes. They automatically assume we're speaking about type 2 diabetes. And that's because it is the most common one that we see about about 80% of people with pre-diabetes, which will lead to the diabetes, they're walking around and they don't even know that they have it. That's why it's so very important for you to have a follow-up and a yearly exam with your primary care provider. So with the diabetes, what happens is the body is making some insulin, but it's not making enough insulin, or the body has become insulin resistant. As we spoke about earlier, that's the role of the pancreas is to push out that insulin into the body to lower the blood sugar. So when that's not happening, these patients aren't able to lower their blood sugar properly. So they end up on medications. They end up, some of them on insulin, depending on how bad it gets. And some of these medications can be a little dangerous. So we want to just make sure we are preventing ourselves from falling into the category of diabetes. And we'll discuss a couple different ways on how to do that here shortly. So again, diabetes, that's where we are getting some insulin from that pancreas, but we may not be getting enough insulin or we've become insulin resistant. Okay. And so let's talk about risk factors. So risk factors are for type 2 diabetes. We talked about it earlier, pre-diabetes. If that's not managed properly, that can lead to diabetes. Gestational diabetes, as I stated earlier, if the pregnant women, they're not controlling their blood sugar properly, they can later develop type 2 diabetes as a result of that. Okay, so those are some of the risk factors. Some other risk factor is how you're eating. You're eating a lot of fried foods. You're eating a lot of processed sugars, simple sugars. So you're eating the ice cream. You're eating a lot of fried food. You're eating just packaged foods that are have no nutritional value at all. So you're eating bad eating habits. Maybe you're not working out at all. Maybe you just kind of sit at your desk all day. You work for hours and hours and hours. You don't move. And then you're eating and working. People like that, or just people who sit and game all day. You're at risk for diabetes because you want to make sure that you're moving around. You want to make sure that you're eating the proper foods that you need to be eating in order to help with um, causing this blood sugar to turn into energy versus just sitting out here in the blood, causing a high number of blood sugar in the blood. That can also lead to a couple other dangerous things that we will talk about. Now, let's talk about the prevalence. So, in type 1 diabetes, we normally see this in our white community more so than in the African American community. We see twice as many African American population that's diagnosed with diabetes or type 2 diabetes than in any other race. It could be disparity. It could just be the fact that they may not have the education or what they need and how to go about eating properly. Maybe they don't have access to different healthy food options. There's a lot to consider as why we are twice as much as the white population to develop type 2 diabetes. And when that's not controlled, then we see other issues such as amputation of limbs. So these people may have to get their legs cut off. They may have to get their limbs, their fingers, their toes, things like that. They have to get those things amputated because they've allowed the diabetes to go on so long uncontrolled that it's caused other issues in this area. So that's why, again, it is so, so very important for you to follow up with your primary care provider on that. So I want to jump more into different things and different ways to go about preventing diabetes and keeping that from happening or lessening your chance. I can't stress enough. The number one thing is having a healthcare provider that you can trust, that listens to you, and also includes you into the plan of treatment and management so that if there is something going on, you can go ahead and make sure that that's managed ahead of time to prevent it from getting worse and worse. So number one, find you a primary care provider that cares about you, that is honest with you, and that includes you in the decision making process. If you have someone already, make sure you're going to your annual checkups if you need to. The second thing is one of the most important things that is lifestyle changes. So that's going to include what you're eating, working out, stress management, all of those things are very important. Sleeping, And when I say working out, I'm specifically talking about workout that includes cardiovascular workout. So your bicycling, your Zumba, things that are swimming, things that is going to get that heart rate up and pumping. And you want to make sure that you're doing that for at least 30 minutes, at least 3 to 5 times a week. That is so, so very important. So again, whether that's climbing a mountain, whether that's jogging, whether that's swimming, whether that's dancing, tennis, whatever it is to keep that heart rate up for that amount of time, that is so important. That's going to help to lower your blood sugar. The foods. The foods we need to focus on is foods that are high in fiber. And we're going to see a lot of this in our foods that is vegetable based, okay? So our plant based options, so those green leafy vegetables, those sweet potatoes. We want to stay away from the white potatoes and iced potatoes, but definitely sweet potatoes are great. Again, your green leafy vegetables are amazing, oatmeal, things like that, because fiber helps to lower the blood sugar in the body. So just making sure that you are eating those high fiber foods. Also, just drinking plenty of water as well. Okay. And so the next thing I want to talk about is a lot of people may not know about cinnamon, which is a spice that is in most of you guys' pantry, I'm pretty sure. Cinnamon is a very powerful spice. It allows us to naturally lower our blood sugar because the cinnamon acts like the insulin that is produced by the pancreas. So as a result, we know that the pancreas gives off insulin. The insulin then causes the blood sugar to be lower. Well, I'm sorry, cinnamon is a natural insulin type spice. It does the same exact thing. So that's why when you're eating it, you want to just make sure you're eating it with meals. So whether you're sprinkling it on your food, like in your oatmeal, or if you want to drink it as a tea, or if you want to be a lot less messy, you can get it even in a capsule. So consuming this spice will really help to manage and lower your blood sugar naturally. Again, it acts just like the insulin that's produced by our pancreas. Okay, and so let's talk about another alternative. This is a herb, but most people have not heard of this. It's called fenugreek. Fenugreek has these little bitty tiny seeds, and I'll show you all what that looks like in case you've never seen it. So fenugreek are these very small seeds. Hopefully you can see them. Very tiny seeds, but they're so very powerful because it also, just like cinnamon, causes us to be able to naturally lower our blood sugar. And as a result of that, those things, seeing your provider annually, exercising cardiovascularly 3 to 5 times a week, about 30 minutes, using a cinnamon, vinegary, and definitely making sure that you're eating those high fiber foods are all things that you can contribute to your daily life to help minimize and help lower your chances of developing this very dangerous and deadly condition or disease. A lot of people do not know, but diabetes leads to so many things. It can lead to blindness. It could also, again, I said, lead to amputation of your limbs. It can lead to kidney failure, heart issues, because it causes issues with the blood vessels. So we want to make sure that we are preventing ourselves from getting diabetes. But if you already have diabetes, making the changes that you need to make in order to manage your diabetes to prevent the issues with it getting worse. And I simply want to just talk about, how do you know that you may have diabetes? Or what are the signs and symptoms, some of you may be asking, that I should look for or that I will have to make myself think or feel that I may have diabetes. And so in healthcare, we look at three really big symptoms, and we call those the three P's. The three P's is going to be polyuria, polyphagia, and polydipsia. These are just big fancy words to say I have to pee a lot, I'm hungry a lot, and I'm always thirsty. So if you find yourself being more thirsty, you find yourself eating a lot, you find yourself peeing a lot, then you definitely want to go in and get yourself checked out to just make sure or to rule out that diabetes is something that you could possibly have. If you're wondering, how will we know what tests are done? Well, we do. We do a couple different tests, but the one of the tests we do is called a fasting glucose test, and that's where we have you to fast for a certain amount of period. You come in the next day, you get your blood sugar, that test taken. As a result, we know if you're pre-diabetic, if you're not diabetes at all, or if you're a diabetic. But the most common one that we use is called the A1C test. That's going to be the most accurate test because it's going to give us an overview of what your blood sugar has been like over the last 3 to 4 months. That's going to let us know whether or not you have diabetes. And we also use that to manage those with diabetes um, in the practice location. So I just want to recap on everything that we talked about so far because I really want you all to take away some very important key factors here to make sure that you're doing what you need to do to prevent yourself from getting this horrible condition. And so, again, we talked about the stages, the different types of diabetes, the different types of diabetes. We talked about the pancreas and the role of the pancreas. But the important parts that we talked about is going to be one, making sure that you're following up annually with your PCP, your provider. That is so important because we want to tackle things ahead of time. Two, making sure you're getting that 3 to 5 days a week, 30 to 45 minutes cardiovascular workout in to help and lower those blood sugars, making sure also that you're eating better and healthier fibrous foods. That's going to be the biggest thing. And then we also talked about two alternatives that you can use that acts like the insulin that is produced from the pancreas, and that is the cinnamon and also the fenugreek. So I hope that you all have something that you're able to take away and apply to your life today to make sure you and those you love decrease your chances of getting diabetes and know that it is preventable. So make sure you're doing what you need to do and make sure you're following up. Again, I hope that you learned something today. I hope that you apply the information. And as always, if you have any questions or you'd like to reach me, you can reach me at drvhinton21 at gmail.com. Again, Dr. V. Hinton 21 at gmail.com, or you can give us a call at 470-407-9672. Again, that number is 470-407-9672. Thank you so much for tuning in today, and I look forward to seeing you next time. Take care and be safe.
And cut. Very good. Very, very, very good. You did a great job.